Good afternoon. It's my pleasure to be with you today for just a moment. First and foremost, I want to express gratitude to our citizens and all those who are participating with us as we strive to stop the spread of this virus. We know that many have suffered and many have sacrificed, and we want to recognize that, express gratitude. In the next few days, you will begin to see more National Guardsmen employed in support of our efforts. And I wanted you to be aware of it before you saw them. The need for National Guardsmen is that they provide expanded capacity to us as we continue to be a leader in testing and tracing across the nation. We will be bringing an additional 120 Guardsmen in. Their focus will be at our long-term care facilities to do more testing for our healthcare workers in those facilities. Also to augment our state laboratory to expand capacity there. And then finally, they'll be able to help us with rapid response to hotspots and reach out to those high-risk populations and those communities, vulnerable groups that might need additional assistance. And so that is the plan going forward as we move down the track to increase testing and tracing and to increase capacity so that we can continue to lead the way as a state. It's important to note that Utah has been in the top 5 almost perennially since we began in testing nationwide, and we appreciate all those partners who've assisted us to make that happen. Thank you. Yeah, I'm available for a question or two.
Hi, General Burton, Brady McCombs of the Associated Press. As you know, the White House set some criteria for states to reopen. 2 of those were a downward trajectory of documented cases within a 14-day period and a downward trajectory of positive tests, the percent of total tests within a 14-day period. Based on the state's publicly available data, it doesn't appear Utah met those criteria. So I'm just wondering, how did you and other state leaders take into account this White House criteria as you decided to reopen parts of the state's businesses?
Yeah, Brady, thank you for the question. I think it's pretty clear that Utah has performed on a much higher level than most states, and I think you can, if you're paying attention to this nationwide trends, you would have to say that Utah is performing very well. The thing that we have worried about mostly from day one is hospital capacity, and that's probably our number one tracker for how we're doing. And you're going to have ebbs and flows in testing numbers and in positives. But it's important to note that Utah is still about 4.2% of all those tests come back positive, which is well below the national average. And the death rate in Utah is at 0.97, which is one of the lowest in the nation. So we feel comfortable moving forward to this point. And this point is orange right now.
Yeah, General, just are you expecting are we anywhere closer to any kind of a flattening of the curve, considering we keep seeing just a larger number of increasing positive cases?
Yeah, we're watching it every day, Ben. And again, we're conferring with healthcare professionals across the spectrum. I think one of the things that makes Utah so responsive in this battle is that we have a great interaction with our public-private healthcare facilities, and so we're paying very close attention to this. We're tracking these numbers on a day-to-day basis, but again, we feel comfortable with where we are. Obviously, we always say to our citizens, please follow the guidelines. Currently, it's a governor's order, and so the information put out by the governor is an order. But he strongly encouraged everyone to wear masks. And I think it's pretty well accepted now that mask wearing can help us keep those numbers down or flatten those numbers just by protecting ourselves and others and being considerate of others. Next.
Thank you, General. This is Chris Reed with St. George News. As you certainly know, areas of southern Utah yesterday requested a move to yellow alert, the less strict risk, and it was rejected. And a commissioner with Washington County, Victor Iverson, said that I'm just quoting him, that the governor and the state owes Utahns an apology for the havoc the state's responsible to COVID-19 has wrought in the economy. How would you respond to that statement, and also any more information as to why Southern Utah is not being placed on a less high alert?
Yeah, thank you for that question. It's a very good one. We strive to strike a balance here, the very best that we can. Obviously, the first responsibility of government is the health and safety and security of its people, and so that comes first. So we focus on the public health, and then we clearly understand. And personally, I'll just say, I have a lot of friends who are suffering with businesses, and I take this very personally. Every business that suffers and fails is a person, a family that's involved in that. And so we take all of this very, very seriously. But we also don't want to rush forward too quickly. And that's why we're moving forward with caution. Those requests that come up are reviewed by myself and then approved by the governor. And we're very aware of the personal impact that this stuff has. So we're striving to strike that balance. I mean, you'll find differing statures and policies or hopes for policy changes in every county in the state. And we take each one of those and address them. So we hear you in St. George. In fact, I just got off the phone with one of the city councilmen down there. The communication lines are open, and we will address any question or concern that you have.
And just to follow up, which councilman was that?
Which city councilman was that?
Yeah.
Brian Smithhurst.
Thank you so much.
Okay, I can do two more questions.
Two quick questions. When it comes to religious services, we heard that there was going to be maybe some updated guidelines. Do you see them coming in the future? Also, what exactly are the National Guardsmen going to do? Are they going to be testing healthcare workers who are asymptomatic, or what specifically are they doing?
Okay, the first question, the church information in the phase guidelines was updated, and essentially folks were getting confused over the 20 or less congregate groups. That was referring to family gatherings, neighbors, friends. When it comes to churches, I'll address it specifically. Churches can resume operation. However, the one non-negotiable stipulation is the 6-foot social distancing required by the CDC. So to the extent that a church can open, maintain that distancing, map the seating, it may be that a small church has to have 3 Sunday services instead of 1. But if they keep that distancing between family groups and make sure that they're following those guidelines, they can open. Secondly, guardsmen will be absolutely testing asymptomatic healthcare workers, but they'll also be testing folks that are in vulnerable groups, communities where there's an outbreak, and so forth. So we're striving to do that in a way that gives us more data and helps to give people confidence as the economy slowly comes back to normal.
Hi, yes, General, thanks for taking these questions. Roger McDonough with KCPW Public Radio. Following up on Brady's question earlier about guidelines for adjusting risk levels, the governor has said that depending on how things go, Utah could stay here in the orange or moderate risk level, or move to yellow, or move back to red. I'm wondering if you can tell us the data, the metrics that will inform the decision to stay here in orange or to move out of it.
Yeah, thank you. Again, I would refer you to the Utah Leads 2.0 plan. We had that plan long before there was a federal plan. It's a solid plan that lays out the road to recovery. And if you look at the phase guidelines that were sent out with the governor's order, and I think all of you have access to that, we're watching it very closely. Obviously, we're worried about our healthcare system and their ability to respond to major outbreaks. I will tell you that those facilities have not been really seriously tested. Those numbers have remained low. You look at ICU bed utilization, bed capacity overall in the hospitals is very good, and it's remained strong through the entire month of April. And so we're watching that very closely. We're consulting with our physicians and leaders in the healthcare community to ensure that we track. And we've got levers. We know when if a condition gets to the point where we have to go back to red, we will do it. If it improves, then we'll go to yellow. And we've been pretty consistent about that all along. Thank you.
Thank you.
Okay, good afternoon. We have 5,595 cases identified, COVID-19 identified here in Utah. That is an increase of 146 from yesterday, or a 2.7% growth rate. We've tested over 131,000 Utahns for COVID-19, an increase of 4,287 from yesterday, and our overall positive rate is 4.3%. We have 8 additional hospitalizations for a total of 464 and a total of 58 deaths. That's an additional 2 from yesterday. Both deaths were in females from Salt Lake County. One was over the age of 85, the other between the ages of 18 and 60 years, and both were residents of long-term care facilities, although different long-term care facilities. So we've had a lot of questions today regarding outbreaks in Utah County that are associated with 2 specific businesses. We at the Department of Health have been working very closely with the Utah County Health Department and those businesses to identify any of the employees with COVID-19, their close contacts, and implement prevention measures. Neither of these 2 businesses have direct interactions with the general public. Therefore, the risk to the general public is very, very low. And we always work to protect privacy and balance that with protecting the public's health. And in this instance, we are able to protect the public's health while maintaining privacy for the business and the employees. As usual, we are asking businesses and the general public to follow the guidelines, the directive, and the order set forth by Governor Herbert. We need to take these recommendations seriously. And businesses need to not only allow, but encourage their employees to stay home when they are ill. With that, I'll take some questions.
Hi, Dr. Dunn. Jim Spiewak with KUTV. My question is in regards to contact tracing and our efforts there. If you could update us on where we are in contact tracing. Are we making a significant impact, and how impactful has the Healthy Together Act been in that effort as we sit here today?
Sure. So for contact tracing, we still have the capacity to do a case investigation and contact tracing for every single individual who's identified with COVID-19 here in Utah. And we've actually been able to expand that. So the ring of close contacts doesn't only go back 2 days, but it actually goes back a full week prior to somebody's onset of symptoms. So our capacity to do contact tracing remains strong. We're in planning right now to determine the best strategy moving forward for sustainability, especially given that, we could need contact tracing, for the next year or 2, and we want to make sure that we have that ability to do it sustainably. In terms of the Healthy Together app, approximately 41,000 Utahns have downloaded it. We're actually working with the app developer today to develop a public health portal where our case investigators will be able to see the location of positive individuals if they allow the investigator to do so. So currently it's not integrated into our case investigations, but it should be in the coming week.
That 41,000 that have...
Go ahead.
Okay. So, Dr. Dunn, I don't know if you saw the New York Times analysis today on excess deaths, but it was saying that between March 15th and April 11th, Utah had 40 more people die than is normal in that time period, but we also only had 18 more deaths. Do you think this discrepancy could indicate that there's still deaths from coronavirus in Utah that haven't been counted?
I haven't seen that analysis, so I'll have to look at it. There's a lot of reasons why our state or any state could be experiencing excess deaths. COVID-19 is certainly one of them, but it's hard for me to analyze kind of the difference between the 40 and the 18 without understanding what other data we should be looking at. So that is something we'll look into. and see if that is due to COVID or not.
Okay, and then I had one more question. This is also from an article that was published today, this one by the Hollywood Reporter, and it had cited about a dozen people who said that after they came to Sundance Film Festival in Park City in January, that they got severe illness, and they're saying that maybe in hindsight, this could have been COVID-19.
Sure.
So is it possible, at Sundance where people are so crammed together during 10 days that it could have been an early, unknown hotspot for coronavirus?
Yeah.
And can or should the Department of Health, be working to find that out?
Sure. So Sundance seems like it was a really long time ago, but it was definitely at the beginning of this outbreak. And we worked really closely with the Sundance planners and Summit County to set up screening and education for all the Sundance goers about symptoms, because at that point we hadn't had any cases. And so we were really just monitoring for symptoms. I don't even think we had a US case at that point. So those measures were put in place. But again, I agree, it is definitely possible that COVID-19 was circulating at Sundance. I would recommend, the people that felt like they had symptoms, they can work with their health department or their provider and potentially get an antibody test. But other than that, there's not a lot of interventions that would be useful to public health at this point.
Got it. Thank you.
Thank you. Dr. Dunn, I also have a question about underreporting. We're also hearing that from some states, there are some questions about whether numbers of deaths reported from long-term care facilities are being reported accurately. Do you have any questions about whether that's happening in Utah? And is there any thought being given towards directing or urging nursing homes to re-examine the number of deaths that they're reporting with an eye towards listing COVID-19 as a cause of death?
Sure. So again, from starting in January, we've had numerous conversations and trainings with our long-term care facilities. We have great relationships with them. So I am confident that we are identifying deaths due to COVID and responding very appropriately to our long-term care facilities and outbreaks. In terms of underreporting for deaths, our Office of the Medical Examiner is testing every single death for COVID-19, regardless of the cause of death, and so far has not identified any extra deaths that weren't already reported to public health as COVID-19. So that gives me even more confidence that we aren't underreporting our deaths. I mean, there is a possibility that, perhaps a couple weren't reported, but overall, I think our trend in deaths and cases is pretty true.
Thank you.
Mm-hmm.
Yeah, hi. What has the state's overall positive rate from the test? How's it changed over the last 14 days? And what's the takeaway from whatever change, if anything,
Sure.
you've seen over that time?
So it's been pretty steady over the past 2 weeks. I don't have the numbers exactly on me, but it is around 4 to 4.2% over the past 2 weeks. With that, we've had pockets where the testing rate has been really low, so in the 1 to 3% range. But at the same time, we've been using our mobile testing capacity to test hotspots and those at really high risk, so long-term care facilities and other congregate settings where we have a much higher positive percentage rate. So the average has maintained still around 4%. That's a really good sign. So the average nationally is around 15 to 18%. So having a statewide average around 4% is a good indication that we don't have widespread community transmission going on in the state. And it is really good that we're able to focus on pockets of spread and hotspots and respond really effectively. And that's going to keep us from having any surge in cases.
Yeah, Dr. Dunn, Ben Winslow with Fox 13. Overall, you said that 4.2, 4.3% is a good sign, but does it look at this point like we are going to be moving toward a yellow in a couple of weeks like the governor had possibly hoped? We ideally would like to see that positive rate drop. So we are seeing a steady 4%. We definitely in public health want to see that positive rate go down. A really good sign is that we've plateaued. I mean, our cases for almost about 2 weeks now have stayed steady. We haven't yet seen the drop, and that's what we're going to be looking for in public health to really feel confident that we have this thing under control. But with regards to going to yellow, I mean, I've said this before, but there are a
lot of factors to take into consideration when creating these sorts of policies. I definitely provide the public health perspective, and we have other experts at the table providing their perspective. And that's how we get to the best policy for Utah. And so it's definitely a team effort.
So you want to see the positive rate drop before you go to yellow. That's your recommendation.
So the indications that public health is recommending in terms of indicators to change colors, to go down in color, include growth rate decrease. So part of one of those indicators is seeing a plateau followed by a drop. General Burton mentioned this earlier, but another key indicator is hospital capacity. And we're very fortunate in Utah that we have not seen a strain on our healthcare systems thus far. So they're starting to open up elective surgeries, and we'll maintain that hospital capacity. And that's another indicator we look at. So those are the two main indicators, growth rate and then hospital capacity.
Thank you, Dr. Dunn. Chris Street, St. George News. General earlier talked about ebbs and flows in the numbers, and there was an ebb yesterday, at least in deaths. By my own math, at least, it was about an 18% increase in the state death rate as of yesterday. Yeah. It didn't happen today, thankfully, but is that an ebb? Is that something that people should be concerned about? What would you attribute that pretty high increase yesterday to?
Yeah, so deaths are definitely the most lagging indicator we have, right? They're the end point of COVID-19 that we measure. So these deaths are attributed to cases that were identified several weeks ago. I think we can have hope looking forward that our plateau of cases will hopefully result in fewer deaths as we move forward in this outbreak. So we are anticipating a drop in deaths and working towards that over the coming weeks and months.
Doctor, you mentioned these two Utah County companies, and then you mentioned that we have to take these recommendations very seriously. Are you saying that these companies didn't take the recommendations seriously? Are they going to be maybe, are there any fines or anything like citations that might be coming their way for apparently not taking them seriously?
Yeah, so Utah County did not have any orders in place when these outbreaks occurred. And so I'm unaware of any regulations or kind of enforcement that's going to be going on with these organizations. But we're working on the public health side to ensure that spread is stopped throughout these companies and then prevented in further workplaces in the area.
Okay.
Okay, thank you guys so much. Have a wonderful afternoon.